obviously, we're all very interested in endovascular therapy, what the therapeutic window is of endovascular thrombectomy, because we basically believe that patients who have salvageable brain can be helped not just by restoring blood flow, but by neuroprotection. So, for example, the ESCAPE NA1 and the ESCAPE NEXT trial both had 12-hour enrollment windows. And one can argue that stroke is a very rapidly progressive disease, and drugs like alteplase, for example, are approved for 3 to 4.5 hours. But the cool thing about the thrombectomy world is that through these trials, the medical imaging criteria for people who are slower progressors and who still have salvageable brain in later windows, they can now be identified. And those are all patients who are also targets for neuroprotection. I should mention that an analysis of the thrombectomy trials to date, although the effect is dramatic, only about 10% of patients with thrombectomy go back to a modified Rankin score of 0. So they can go back to life as it was. So 90% of patients with stroke, even with thrombectomy, are still impaired. So there's a large unmet need for neuroprotectants to increase that proportion of patients who are functionally independent and patients who go back to life as it was. So I'm certainly looking forward to seeing what's new in endovascular thrombectomy and where else drugs like Nerinetide can be of help.